stanford.edu/research. We're cited in the AHA 2019 AFib guidelines, the ESC guidelines, the Heart Rhythm Society post-ablation guidelines. And we're involved in the largest AFib screening trial that's in the primary care setting, currently being conducted at MGH, called the VITAL AFib study. And they've randomized 15,000 people to getting cardiomobile when they're being seen in the primary care office. These are examples of the recordings that you can get when you are in a relaxed, quiet setting. You can get anything, right? It's lead one. You can get normal sinus rhythm. You can get sinus rhythm with PVCs, wide complex tachycardia like a VT. You can get supraventricular bigeminy, the whole bit. Whatever you could see on a typical rhythm strip, you can see with cardiomobile. AFib, SVT, complete heart block, and then the last one I love, this happens quite a bit, double artifact, because the way that the ECG works is that the digital ECG that you're taking is converted to high frequency ultrasound. And those sound waves are then transmitted through the microphone of your phone and then reconverted back into an ECG signal. So it's not, Lisa's current version is not paired with your phone. Anyone can use the device. We do have new versions coming out that will be Bluetooth paired with your phone. Okay, so the market for single lead ECGs. Yeah.
How often do you see acceptable atrial waves? You can tell the ventricular complexes.
Yeah, so this is a good question. Like the P waves in lead one are kind of a give or take. A lot of people have isoelectric or flat P waves. And so it is quite a challenge with lead one to be absolutely certain that the regular rate that you are seeing, the regular rhythm in front of you is in fact the sinus rhythm. I would say it's going to be, we have a new device that will be lead 2 and lead 1 simultaneously, and we found that there's been a reduction in that kind of ambiguity, I think about 20% of the time. So it really depends on the patient population. Younger folks tend to have very flat T waves.
That's
Women,
the problem I've had with that and other devices is that it's hard to tell.
Yeah.
You see the P waves, you can't tell what's.
So one thing you can do with cardiomobile is you can take it in your right hand and apply it to your left knee, and you will get lead 2. And then that will give you better P waves. So that's in our instructions for use, you know, like, so the FDA is aware of it, so you can do lead 1 or lead 2 on it. So the EU, because they have these guidelines that came out in 2016 promoting, or 2014 promoting AFib screening, there's been a plethora of devices. They are almost all prescription only, but you have the gamepad looking thing, the Xenocor, the My Diagnostic, which is that stick people can grasp, the Rhythm Pad, where you go into a pharmacy, put your hands on a pad, and they do the ECG that way.
Hopefully they give you a flu shot right after that.
Yeah, at the same time, it's poke you at the same time.
They got you stuck there.
I know.
So they
Right,
inject
it's
you
like,
at the same
well,
time.
And a blood pressure at the same
You're gonna get
time.
flu if you just do that.
Yeah, that's kind of dirty. Yeah, that's right. In the U.S., I would say most prominently, we have the Apple Watch Series 4, which is basically the same idea. You are making a connection. You have your right and your left hands generating a lead 1. You have the Withings Move ECG, which will be on the market in the next coming weeks, where you don't actually see the ECG on the watch, but you can see it on the phone. And Cardioband, which is this one here, which is from AliveCor. The history behind that is that we released an accessory for the Apple Watch that was FDA cleared about a little over a year ago. We knew Apple was coming out with the Apple Watch. We didn't know the exact timing, so we came out with the accessory, and we're no longer actively promoting it. It's available for sale, but it's not our primary strategy at this point. But now we can always say we were the first FDA cleared accessory for Apple Watch, but it's not a primary focus of the company at this point. Okay, so the second way that you can get a surrogate for atrial fibrillation evaluation, especially direct to consumer, is with something called photoplasmography, or PPG. And what this means is you have an optical technique where you're detecting the pulse by analyzing changes in skin color and light absorption using a light. And the light could be on the back of your phone, like the camera light, or it could be on the back of the iPhone, that green light that you might see on workout mode. That is used to detect a PPG-based signal. And you can use the PPG-based signal to get a sense of, an accurate sense of your pulse. You don't get an accurate sense of the ECG morphology, so you can get basically a sense of the spikes of your pulse using the PPG, but you don't know if you have an irregular PPG, whether that is atrial fibrillation or, for example, sinus rhythm with extra beats. So it's very good at distinguishing normal from AFib. It's not so good at distinguishing atrial fibrillation from other irregular rhythms. But this is the type of thing that you might see on the app. So the person who came in with the smartphone probably downloaded a free app on their phone, and they put their finger on the back of the flash, and they were able to get a PPG signal that told them that there was basically an irregularity in that PPG waveform, which is akin to the ABG, the invasive arterial blood pressure. So the thing about those devices is the FDA has this term called enforcement discretion, where they've decided that they are not regulating the field of heart rate. So you have lots of apps and other devices that will make claims about heart rate for fitness or general well-being, and the FDA has decided that they're not going to go after these companies for making claims that aren't substantiated. So there are a plethora of apps that will talk about heart rate and irregular heart rate, but the apps that are making claims about possible atrial fibrillation are in fact regulated by the FDA. So FDA cleared apps for using PPG include the Apple Watch app and another company out of Europe called FiberCheck, which just uses the phone. You put your finger on the back, and they make claims about detection of possible atrial fibrillation, not just irregular rhythm. I've included a list of the sensitivity and specificity of different methods of AFib screening to get you a sense of performance. For the AFib algorithm for AliveCor, we have a sensitivity in the high 90s as well as a specificity in the high 90s. The caveat is that it really depends on the quality of the study. It depends on the patients that are using the device. It depends on how well study coordinators know how to use the device to avoid artifact, because artifact is inherent in any non-gel electrode-based ECG. Yes?
Is 4 millimeters of ST elevation a problem?
On yours?
We'll be
Yeah.
taking.
That's a problem. I'm just curious. Yeah.
I'm going to call them
Do you have any?
Mary, what do you have in your bag?
Right here.
I'm sorry.
No, I mean,
She's like, what?
well, they're probably upsloping and their repolarization changes, I'm going to call them that. But no, it's an issue in terms of what you can or cannot detect with ambulatory bandwidth ECG. So these devices are not intended for ST elevation or ST depression, although there are lots of anecdotes online, but people are using it for outpatient ischemia workup. The thing about the PPG monitor is it's not terribly specific. It's very sensitive. So again, if you get a regular rhythm notification on a smartphone app, you could definitely believe a negative, but if it says possible irregular rhythm, you don't know if it's AFib or sinus rhythm with ectopic beats or artifact or whatnot. So yeah, we go to the very bottom, you see the specificity of the iPhone PPG or the finger PPGs in the low 90s.
So at what point are you telling the patient or the member with that to go see the doctor or do something about this? I mean, do they have how many repetitive or?
The device alignment.
Yeah, what?
So for, let me show the whiteboard. So the Cardia app, the screen says your EKG shows signs of AFib. This is not a diagnosis, only a possible finding. Contact a physician if you have questions or are concerned about any symptoms, but there's no requirement of repetition or anything like that. So
Yeah, I'm thinking more of the app, like this type of thing where it's like, okay, if you had it 2 times or 3 times or, you know. at what
Yeah,
point
it's
is it kind of pushing them, or is there any type of alert? Because I know there's a lot that's been where different apps, like even medication adherent apps,
Yeah.
where you could have a family member that's linked to it. So it tells the family member, hey, your mom has not taken her
Yes,
meds, whether
yeah.
today or in the last 2 days.
Yeah,
Can something
so
like this-
all of those apps that are medication reminders, medication wellness, general wellness, they're not regulated by the FDA. So
That's fine.
it's a wild, wild west, basically.
Well, but that's what I'm saying here. I mean, we want someone to take action. You know, I'm monitoring.
Yeah.
Or how do we change that behavior? It's like, well, I guess I better go to the doctor. You know,
Yeah.
that's what I'm asking.
Yeah.
What are you guys encouraging? Or
So
what-
we don't have a PPG-based product. We have an FDA-cleared Class 2 medical device. So we're not
So
in
then
this
that-
space.
So
Yeah.
the answer that's probably the best out there right now comes from the same study that showed that 24 hours a day shift was the most significant. The cutoff they used was 6 minutes. There are ongoing trials to answer this question. Right now is how much AFib is significant.
Because I'm just saying, if we're trying to get a health plan to use your device or an ACO population, you know, we want to change behavior. Let's minimize that. So that's what I'm trying to get to, is that next level. Like, hey, we're gonna buy in your device, but then, you
I think
know,
that's a great thing we can discuss in a breakout, because this technology is available, but then what's the next step?
Yeah.
And some companies are like building broader platforms, and some aren't, and that's their prerogative, but I think our prerogative as physicians is leverage this.
Yeah, I mean, the key thing is it's under the care of a physician, right? So the expectation throughout all of that, when you read the terms of service, no, I mean, it's not intended to be, you know, out in the Netherlands, the hinterlands, having someone try to Google what they're supposed to do next. I would say that a 30-second ECG of AFib is being used as if they were in the office and doing a 10-second ECG in clinic. So people believe it, and they're acting upon it, especially if their CHA2/VASc score is high enough.
But for this device, I mean, Hattie, did you ask a physician for a prescription, or did you just buy it?
Oh, this is
So-
direct to consumer.
Right.
This is,
So that's, the devices are direct to consumer, but the responsibility, the information will come back to the physician. So let's talk about this breakout.
yeah, that's what I really, and I wonder if we should do breakouts, or just since we're small today, have a discussion in the round, but I don't wanna cut.
I'm almost
off.
done. I'll be very
Yeah.
quick.
Just one-
So I'll be a little late to it. So I wanted to give you some caveats about the Apple Watch ECG and the PPG app, because you have to kind of delve deep to figure out like what the FDA has allowed or not allowed them to do. The horrifying or fantastic thing about, depends on how you feel about it. My physician hat is I'm horrified, and like the digital health part of me is excited, is that there's no physician oversight with the Apple Watch. Like when you get a cardiomobile ECG, you are required to have your first reading reviewed by a board-certified cardiologist, because back in 2014, that was the arrangement we had with the FDA. There had to be some physician oversight. So there was some person looking at your first ECG before the app was unlocked, and you would have unlimited ECG use. And so now Apple has removed that that unlock function, and now anyone can buy an ECG, Apple Watch, and do it. They will. So it's really opening up the possibilities to having no physician involved at all in the acquisition of ECG. So it's a big deal. But the ECG app on the FDA website says that the ECG from Apple Watch is not recommended for users with rhythms other than AFib or sinus rhythm. It has not been validated in people who have lots of ectopic beats, PVCs, PACs. If you have atrial flutter, it hasn't been validated in those rhythms, so pacemakers, whatnot.
Is it a 12-lead ECG?
It's a single lead one.
Lead.
Mm-hmm.
Didn't AliveCor have a 12-lead ECG?
So at AHA last fall, we have a research prototype with a wire attached, 2 wires. It's a little embarrassing to discuss this, but basically what they did is they took the single lead ECG and took 9 consecutive recordings, and calculated the residual 3, remaining 3, to get a 12-lead ECG. So yeah, it's kind of a scientific exercise of how do you do outpatient 12-lead ECG, but it's definitely nowhere near commercialization, because you had to take 9 consecutive single-lead recordings. Yeah, that was presented at AHA.
So in my old hospital, that's what we did. We had one lead
You
and you
did?
changed
Oh,
it.
that's
And
amazing.
you,
No way.
And you taped it out onto the little boxes. I mean, they were 12 lead EKGs. You did
I had
12.
no idea that
Right, so-
existed.
Yeah,
Well, the problem is.
Not with your advice.
No, we have a research yeah, but in real life he was doing that.
Because it was it's
First
a
generation
resource.
AKGs, that's all they were.
Yeah.
I'm young, I don't know about these things, I'm learning, thank you, okay. Wow, okay.
I'm not bad. I remember that.
I don't remember that, okay. So finally, the other thing is, you might have patients come into your clinic saying that the green light under the watch, the PPG app has told me that I have an irregular rhythm suggestive of AFib. And to get that screen to pop up, the user has to be still during recording. So if they're walking around, the Apple Watch is not going to record your heart rate at that time. And you have to have 6 consecutive PPG recordings, and 5 of the 6 have to be irregular. So there's this particular threshold that you have to cross in order to be told you have an irregular pulse. So there's that
With
timeline.
cardia, is there something in the rhythm detection algorithm, it has to be a certain duration, it's just, you're just taking it in EKG?
You have to take at least a 30-second ECG, and we have an RR variability calculator, and we also look for the presence or absence of P waves when we're doing the algorithm.
So, before you dash off, I have to ask this question.
I'll be back at 6:15.
Okay, all right, so we'll tee up our questions, but one thing that everybody should know is that you do link to medical records.
Yes.
Yeah.
So we have a portal.
Pull through.
Yeah, there's a CardioPro portal. You can look at ECGs. The portal is free for physicians. We sell, okay, I'll go quickly through here. So if you're direct to consumer and you want to pay a subscription, we have a subscription model where you will get these summary reports mailed to your home. Again, this is outside of a physician. It has blood pressure and ECG, and it has a list of all of the ECGs that they've taken over the last month. That gets mailed to consumers, and then consumers can take that to their physician. If you have the app, the free app, you can get a PDF emailed, single PDF emailed to you, and that doesn't cost anything. If you are a physician interested in using this in your practice, we have a web-based portal where the ECGs are easily and immediately accessible for review. We have a strategic partnership with Omron, so if you have an Omron cuff, that data can also be instantly uploaded into the portal, so you can see relationships between blood pressure and AFib.
That a certified BP cup?
Yes, it's a FDA cleared cuff. Yeah, so the Omron Evolve, this is in the market, yeah. So this is an example of looking at the blood pressure data. You can look at hypertension or normal, and you can compare it with your AFib data, and let me show you this thing here. Yeah, so there's 2 billing codes that have come out in the last couple of years, 99091 and 99457, and that enables remote patient monitoring of patient-generated digital health data. So it doesn't have to be, it could just be someone taking their blood pressure at home and uploading into some smartphone app, and the app connects with some Epic portal, right? That also counts as remote patient monitoring. What can I say? For 99457, you don't need to be a healthcare provider. You can be a medical assistant, clinical staff to support the work. 99091 is qualified healthcare provider only. I think the average is about $50 a month to review the data. And coming up in 2019, we are going to have a 6-lead product. We'll be demoing it at ACC and AHA and ESC and HRS and all the other cardiology conferences. It's a Generation 2 cardiomobile. This one, you'll have it in your hands, but then you also rest it on your knee, and you will be recording lead 1 and lead 2 simultaneously, and then we calculate the remaining 4, and you get a 6-lead ECG, and that's with the FDA right now, pending 510K clearance. That's gonna be a whole nother bag of worms. Like, the more data you get, how do we convey the data to patients? We are grappling with this at the office every day. How much is too much information versus patient empowerment? These are all issues.
Amazing.
Yeah.
Really amazing. Okay, we'll let Jackie go.